Today, I have the privilege of speaking with Dr. Josef, a board-certified psychiatrist who specializes in identifying and treating psychiatric adverse drug reactions. As a former FDA medical officer as well, Dr. Josef brings unique insight into the flaws of a system that often relies on medication as the primary or sole intervention for mental illness. Through his YouTube channel, Dr. Josef, he offers essential guidance to help people safely taper off psychiatric medications and to recover from side effects. His work is really reshaping the conversation around mental health treatment and empowering individuals to take ownership of their care. This is a conversation that you don't want to miss. All right, so I just had a wonderful conversation with Dr. Josef for his channel, and so I'm so excited to be getting to interview him on our channel now and bring his perspective to our audience too. So thank you so much, Dr. Josef, for joining us today.
Really glad to be here. Thank you.
So maybe to start things off as kind of a setting the tone for this interview, I think that an inevitable criticism that has come up anytime I talk about deprescribing and tapering is this idea that I am coming from a place of being anti-psychiatry or anti-psychiatric medications. And I think it does need to be a more nuanced conversation than that. And so I kind of just want to start this off by getting this out of the way and asking you, are you against psychiatric medications?
I don't think it makes sense to be against psychiatric medication. So I'm not anti-psychiatric meds at all. I'm anti this system that dishes them out. So I have a lot of problems with how we explain what the medications are to people, and how we often use them before exploring less risky alternatives. And so there's no problems with drugs. And really where I fall down on it is I think you should use medication, especially if you've tried all of the non-drug interventions first. And at that point, I don't think it would make sense to not use them. I think you should.
Yeah. And I kind of agree with that perspective and encourage everyone to check out your YouTube channel to learn more about your approach and your perspective and what you do with the Taper Clinic. But maybe we can start off by asking you, can you share a little bit about your background as a psychiatrist and where you've come from and how you kind of became interested in tapering and deprescribing psychiatric medications?
Wow. Okay. Yeah. So I'm from Sydney, so I'm Australian, as you may have realized. So I did my medical school over there, and then I came to the US and did psychiatry residency here. I was interested in psychiatry just because I was kind of interested in my own life in many ways and the things that I struggled with. And so I was always interested in philosophy, self-help, and things like that. And so when I was in med school, I said, being a psychiatrist, that could be a cool way to merge those two interests, because I was always fascinated with that. And I think where the journey towards being a deprescribing psychiatrist started was really as soon as I got to the US and I started in my psychiatry residency, because intuitively to me, coming from my background and with all of these interests, I was thinking we would be helping people at the cause of their problems, and oftentimes I think the causes of their problems would be in their relationships or at work or in social issues, and yes, we would be using medications for serious mental illness, or in some cases where we needed to because we couldn't, facilitate the change in their life, and that would be okay. But that was not what I saw at all. In fact, what I saw when I went into training was that we would not spend a good amount of time talking to people, and we would prescribe the medications to them pretty quickly, without really understanding much about these patients. And it was just something that kind of had to be done that way because of the way the insurance system was set up for the department to be profitable. A lot of the times you were seeing follow-ups, 4 of them in an hour. And so when you're practicing in a system like that, you just kind of increase, lower, or hold the medications. Those are the levers that you pull. And it just felt wrong to me. I just felt, how can we expect to help people if we're not going to understand them? And so a few other threads in this. So was that I wasn't happy with how we were using the meds. And then people kept on saying that these drugs were, safe and effective was what I always heard. The meds, they're safe and effective, and sure. But as I got more, as I became, as I saw more patients, I mean, I realized that a lot of the times the drugs would wear off, or we would need to change the dose, or we need to add medications. And so it hardly looked like it was a sustainable solution for many people. They looked very imperfect. And then I started seeing people who were having severe problems with the medications. They would develop, tardive dyskinesia or akathisia, or they would just get worse the longer they were on the meds. And that wasn't ever being spoken about. And I didn't really trust myself at the time. Like intuitively, I was like, we shouldn't be giving out these drugs that much. And they seem very risky. But when I would bring it up with my professors and the people above me, they would just think I was overreacting. And I questioned myself because I didn't know a lot at the time. And I'm pretty dogged with how I approach things. And so I decided I was going to become a drug safety expert. And so I said, well, I really need to understand the risks of these medications. And so I'm going to go and do that. And so I worked in the pharmaceutical industry. I ended up working there for about 2 years. And then I also worked at the FDA for a year to really understand how our leaders in psychiatric research studied the drugs and then communicated the risks to the public. And man, I mean, if I was cynical before then, I mean, I was even more so after I came out of those places. Really, in summary, the FDA doesn't really do much in terms of overseeing the medical care. They kind of make sure a clinical trial is run, according to specifications, and they publish a label, and then it just goes out of our hands. Doctors, do whatever you want with them. The drug companies, on the other hand, they have an agenda to make the drugs look, to make the benefits look as good as possible, while ignoring or mentioning the harms as little as possible, because for them it's an existential threat. I mean, if you mention the harms of your medications more than the minimum necessary to be on the market, your competitors seize on that, and then they will take that information and show it to all of the doctors, and then the doctors will buy the other drug. And so there's a lot of these market forces going on there that really leads them to skew how they present things. And so I saw that piece of it, that, there's actually this huge machine that was kind of trying to make doctors see the drugs as a lot more, a lot safer than they were, and a lot more effective than they actually are. And that was like the perfect storm for me. I was just like, okay, we're giving them out too much because of the way we're encouraged to see people in such short visits. And then there's this huge like marketing machine from the drug industry just kind of skewing the way doctors see them. And then, I was writing about drug injuries, also just in journals and book chapters. And so people started reaching out to me for help coming off the medications. And I had never been trained to help people come off these drugs. And I was just all about it, because I really sympathized for these folks who had been maybe oversold on the medications, or maybe they weren't, or they just got trapped on them. And I really wanted to help them come off. And so I spent like the last probably 4 to 5 years getting to know everyone in the drug injured space and in the deprescribing space, teaching myself how to taper. And again, realize that there's no formal education out there for doctors on how to safely get people off these medications. We're taught that they are, that any kind of withdrawal is mild and self-limited. That those were the words that I heard in my training. And yeah, so because getting off the drugs is not good for drug sales, no one ever mentions it, but there's actually a huge amount of people with lived experience getting off these meds, and a couple professionals out there that do it. And so I built relationships with them, and all of those experiences sort of came together and shaped the Taper Clinic, which is what I founded with my wife, also a psychiatrist, where we really focus on helping people find an off-ramp off the drugs if that's what they choose.
I mean, that was a really, really great overview of kind of coming to a place of gradually seeing all the very different holes and flaws within the system and how we approach psychiatric care. I liked what you said about how there's often so much more to an experience of mental illness or of mental health symptoms that need to be addressed beyond just giving medication. It's kind of naive to think that just providing medication could solve a variety of other aspects of what it means, to be a human in the world that also need to be addressed and worked on. So thank you for that overview. That was really great. I'm wondering can you tell us a bit more about the Taper Clinic and how it operates to support patients?
Sure. So we have, I guess, maybe it's 4 pillars now. 4 pillars of treatment. So when someone comes to us, so we get a variety of people. We have some people with serious mental illness. We have some people just with your garden variety, anxiety and depression. The way we help them is by doing 4 things, which I think we do really well. So we offer metabolic therapies to people, guidance on how to do things like paleo style or ketogenic diets. We do functional medicine as well. So, looking for root causes, toxicities, nutritional deficits. We do expert tapering. So we do slow tapers. For some people, if they've been on medications for more than 5 years, we might take them off over 1 to 2 years, really gradually trying to help them come down without triggering withdrawal. And we have a lot of strategies there. And then we do supportive counseling. And so we also help people transition to, life off medication as well. So those are the sort of the 4 pillars that make up the Taper Clinic. And it's kind of how it's what we've built so far, which we think are the key ingredients to help people have the best shot at coming off their meds, or at least lowering them to a level that they're happy with.
Yeah. So you mentioned one of the barriers, kind of as a psychiatrist, trying to support people in this way being kind of the way the system is structured, or insurance, or, that kind of thing. So how have you made that work, kind of using an alternative model to psychiatric care within that system? Or are you operating outside of the system?
Yeah. So we operate outside of the system completely, because it just the insurance system here, they really pay for, what I think is a really poor level of care a lot of the time. The way they reimburse, it's to see someone in like a 15-minute visit. And this is one of the things that's really unfair, because I think people expect that their insurance should be able to provide a really high level of care. But I think with mental health, it often falls short. And I think it's really hard to get quality mental health care where it's covered in your insurance. So we went a different route. We built it around the result. So if the result is getting people off the medication safely, that's where we started. We said, we're going to build something around this, and then we'll try and fit in the reimbursement the other way. So for us, people will pay to join the program, and then we give them super bills to take to their insurance company. But we don't take insurance, and unfortunately, a lot of what we do isn't covered by insurance.
Yeah. I think that's something that we're kind of realizing too, is that what is covered and what is ultimately accessible for a lot of people is basically just medication. And there's been a criticism from a lot of people that, I can't afford to eat medical ketogenic diet or to access these other forms of metabolic therapies. And so, I don't know, that's really seeming like a very obvious place that the system needs to kind of catch up and evolve to incorporate. But kind of shifting directions a little bit, getting more into the tapering process. Can you maybe explain what are the basic principles of safe tapering?
So the real risk with drug tapering is that you move too quickly and you develop a lot of withdrawal symptoms that, one, they can make you feel like the underlying condition has come back. And sometimes it has, but sometimes the withdrawal symptoms do look like that. And then it can also, for some people, more so people coming off antidepressants and benzodiazepines, it can cause something called a protracted injury, where if you come off the medications too fast, you develop some pretty bad neuropathy. And it causes a lot of disability, so we want to avoid that. But we also want to help people come off the drugs without major disruption to their lives. I mean, we don't want people missing work. We want people to fulfill their roles around the home. And so our tapering, the way we want to taper people is in a way that their life continues as normal. And so to do that is not as straightforward as just, cutting pills sometimes, because especially as you get to the lower ranges of the drug, sometimes the precision of cutting the tablets doesn't allow you to kind of lower the dose precisely enough to avoid withdrawal. And so what we end up doing a lot of the times is we put people on liquids, and we use liquid formulations of their medications, and we use syringes to gradually lower the dose. And we follow people with diaries. And our metric for success, and we meet with our patients multiple times a week, or sometimes every week. They come as much as they want to. Our metric for success is that they can have some mild withdrawal symptoms, but they can never have it to the level where it gets in the way of them working or being with their family. And so long as we respect that, we just work with them on a weekly basis to adjust the rate of reduction. And that's how we taper. But this is for some people, they only need a taper because, let's say, they got on antidepressants or maybe some sedatives for a contextual stressor in their life, like a divorce or something like that. And now that's gone away. They don't need other help. But we also help a lot of people who have symptoms and they just say, "Hey, Dr. Josef, this has just come out of nowhere. This is not commensurate with the stresses in our lives." And so for those patients, obviously it's really hard to just taper them off the medication because the problem's going to come back. And so that's when we use the metabolic therapies and the functional medicine and sometimes the supportive counseling if it's more like an interpersonal or a relational type of or a work thing. And so depending on the person, you always have to do the tapering with other non-drug interventions to replace the medication.
Yeah, that's kind of what we've been trying to really convey through our channel and sharing my experience, is that it's not just a matter of having gone off the medication. We swapped it out for a different therapeutic intervention, medical keto, metabolic therapies, and that was an important component of the puzzle. I also really like what you're talking about in terms of trying to help people navigate this in a way that doesn't impact their life drastically. Because I shared with you in our last interview that I probably went way too fast. And I did experience some debilitating withdrawal symptoms, and that's probably not advisable. And, other people have come to me and shared, I'm having great success. I'm feeling the best I ever have with metabolic therapies. I think I'm even starting to experience some potentiation, but I'm just so scared to adjust my medication because I'm a parent or I work and I don't want to not be able to show up in those realms of my life. And it's feeling like this scary thing. So yeah, I think that's a really great way to approach it in terms of going so slowly that it doesn't really impact your life.
Mm-hmm.
But you talked a bit about withdrawal and even brain injury, but can you maybe talk a bit more about why tapering is the recommendation over simply stopping medications abruptly?
So when you're on these medications for, I would say any more than, I don't know, maybe even 3 to 6 months, but especially for people who have been taking them for years, they are disrupting our neurotransmitters. I mean, that's how their therapeutic effect comes about. It's by modulating our neurotransmitter levels. But our neurotransmitters are involved in the physiology of our body. So they control how our heart beats, our immune system, our gastrointestinal tract. And so when we take these medications, we actually throw those systems out of balance. And because the body doesn't like that, it sends signals back up to the brain to tell the brain to adapt and change to sort of counterbalance those drug effects. And so the brain actually changes over time to accommodate the drugs. And that's why many people have the experience of maybe needing to go to a higher dose after, a year or so on the medications because their brain has adapted. Now, the problem with stopping a medication abruptly is if you do that, it's like you yank all of this scaffolding out of the brain. I mean, you've got a brain that's grown around the drugs and the presence of that chemical, and you just pull it out. It's going to throw all of those systems into disarray, and particularly your psychiatric particularly your mental health. And so you can become disinhibited, you become suicidal, you become highly irritable as well. And some people even have neurological symptoms, like they're sensitive to bright light, or there's zaps going on. They have brain zaps, or their hearing is disrupted, or they have tinnitus, and that's because you've essentially pulled these parts of the brain out. So what we do with the tapering, and the goal is to slowly remove the drug in a way that each time you do a reduction, the brain has a chance to readapt to the absence of that drug in a very controlled way, and that just allows you to gently come off the medication over time. It's just a much smoother ride, because if you just jump off, your life falls apart. You might end up in the psychiatric hospital or worse, and you may decide, hey, I'm never going to do that again, and it's a really negative experience. But if you do it slowly, you just build up confidence over time. You feel, and you can. It's a much easier way of getting off the drug smoothly.
Yeah, I really like that kind of metaphor of the scaffolding in your brain, and you have to take off small chunks so that your brain can kind of adjust to the removal of that small bit of scaffolding and whatnot. But so I guess the approach is to go as slow as possible so that your brain can adjust. But if there are still some withdrawal symptoms that are coming about, even with a very slow taper, is there anything that can be done to kind of help manage these withdrawal symptoms, or to kind of abate them a little bit?
Sure. So, I mean, the main lever to pull with withdrawal symptoms is to hold the taper or to slow the rate down. But the other thing you have to be really mindful of as you're removing medications is there could be totally legitimate things going on that don't have to do with withdrawal. I mean, you may be unmasking a problem because I mean, these drugs do work. They do mute symptoms that you're having, and so if you're starting to have symptoms as you're coming off, that's when you really want to look at, what are some of the other things I could do to control them? Whether it's a metabolic therapy, or whether it's looking at, functional or integrative medicine approaches, or it might just be looking at legitimate things happening in your life which are distressing and would be distressing for people, and so you just want to make sure that you're not missing something legitimate. But with respect to the withdrawal symptoms, it really is about just slowing down the rate of the taper.
Okay, yeah. I'm glad you brought that up again. I really like how I've heard you talk many times about looking at elements such as various life hardships on an individual level, or the individual's physical health, in terms of figuring out how to most effectively address mental health. Mm-hmm. But do you have any more insight to share, or any other facets of that approach in terms of how you approach each individual's personal circumstances when trying to improve the care you provide?
Yeah. So that's exactly it. It has to be really individualized. I mean, as I mentioned before, I mean, some people that come to us, the reason they got on the medications is really clear. Some well-circumscribed trauma, which isn't affecting them anymore, and they don't need a lot to come off the meds. But other people will come to us, and I mean, they may be having psychiatric symptoms because they're sensitive to gluten, or they have a lot of metabolic problems that might be reversed with a ketogenic diet, and their brain is essentially starved for energy. They could have problems with their gut health. They may be on a statin or another non-psychiatric medication that's making them worse in some way. And so we have to look at all of the variables that may be contributing to their symptoms, both, medical problems, medications, life stresses going on, and you just try and address them in any way you can. And really the goal is, and I mean, some of these things, you may address them all, and the people will still have symptoms, and you may still use medications at that time, but it's coming from a much better place, because now you've tried everything that you could to minimize the medication burden, and that's and to me that's an outcome that I'm still very happy about. If we can just lower the medications having addressed all those things.
Yeah. I think that that's maybe like a really big gap in terms of mental health care is it's very siloed apart from other forms of healthcare. Personally, I, have been navigating the mental health care system with my schizoaffective disorder, but I've also been diagnosed with PCOS, polycystic ovary syndrome, and a pituitary microadenoma. And I kind of just always suspected that these must be interlinked somehow or have some kind of effect, but I could never find any specialist or any doctor who would actually take a look at all of these as they relate together. It was just one for this, one for that, and one for that. And so it's cool to hear that you're kind of trying to more holistically address health as a broader concept.
Yeah, and I mean something like, and I wonder, did the PCOS improve when you started your metabolic therapies? Because oftentimes we hear about PCOS with going along with other metabolic problems.
Yeah, so like my menstrual cycle was non-existent, very irregular my whole life. Starting keto, it's really, really regulated. It's still not completely normal, but it's really improved. And even I shared with you that we tried medical keto back in 2020, and that's actually the year I got pregnant with my son. So there was something happening even then with PCOS and fertility and stuff. So yeah, that's just further evidence that it's all connected and all needs to be considered when we're looking at even mental health symptoms.
And when it comes to the metabolic stuff, I think, yes, if there's some obesity or there's some PCOS and you're having psychiatric symptoms, I mean, it's screaming for a ketogenic therapy because that may improve all of those things. If you're someone who's having psychiatric symptoms and you're having like skin rashes and joint pains and back pains and brain fogs, it's screaming for an anti-inflammatory diet. It's saying, remove gluten, remove dairy, try and get rid of the common intolerances that people have. But we don't do these things. We send someone to a psychiatrist for the brain fog and the depression, the rheumatologist for the joint pain. No one puts it together, and a common denominator for a lot of these things really are dietary.
Yeah, and I'm kind of starting to understand that these symptoms that we equate to mental illness, I never really understood why they were happening, are symptoms of kind of broader issues within the body, not just the brain. And so, yeah, that's kind of been interesting to kind of tease out more. But in terms of getting back to understanding tapering, I just wanted to also ask you if there are any particular medications that are especially challenging to taper off of or that require a little bit more care or diligence when trying to taper down on.
This may surprise people. The hardest medications to taper off, in my experience, are antidepressants and benzodiazepines. They seem to cause more problems than antipsychotics or mood stabilizers, from my experience. You have to go really slowly with them. I don't know what it is about those medications, but all of the antidepressants, apart from Wellbutrin, which is a more stimulating one, they tend to be, and this is not hard as in like it's going to be painful for you to come off. For a lot of people, it won't be. It just means you have to go slower. So you have to move. I find that you have to move much slower with antidepressants and benzodiazepines. Antipsychotics are still quite challenging, but I don't find them quite as hard. Across the board, all of them apart from the stimulants, so things like the Adderalls and Ritalin and things like that, all of them are really are challenging when you get to the low doses. So when, and I say the low doses is usually like the entry level dose that someone takes. And so that might be, a milligram of Risperdal, or it might be 50 of Zoloft. Once you get below that level, people are often surprised because maybe they've been able to taper at a much faster rate to then, but once they get to that low level, it's like a metaphor. Like, people will experience a lot more withdrawal symptoms if they're not careful. So if you imagine that the drug is just kind of like floating around this receptor, you've got lots of like excess drug, up until you get to that lower amount, and then like maybe you just have like a little bit of drug. And so any little bit that you remove once you get to that lower amount, your receptor just feels it so much harder. And so for anyone out there listening to this, don't be demoralized if you struggle to come off that last bit of the drug, because you're just at a level that when you remove some, you feel it at the receptor level more. And so you have to just move slower. It doesn't mean that you can't come off. It just means that you have to move even more gradually. And oftentimes when you get there, you'll have to have your doctor transition you onto a liquid medication to get the level of precision that you need to come off that last amount without having symptoms. So there's definitely a way to bust through that. Another thing that I will say, I mean, because I know this is, you have patients with schizophrenia and schizoaffective on here, probably the antipsychotic that causes the most grief for people to come off is Invega. And that's because it comes in a delayed release capsule, which you cannot tamper with. And so the two options for tapering Invega is you have to get someone to swap you onto Risperdal, or if you don't tolerate Risperdal, I think Seroquel is quite a nice drug to taper from. So Invega's the one antipsychotic that can be, a little bit more tricky in terms of being able to start cutting the tablets and turning it into a liquid.
Yeah, that's helpful to know. Thanks. What you said about it getting progressively more difficult the lower the dose is we're very much in line with my experience of, as I got down lower, the withdrawal really got worse and more intense. And I think that's something that I kind of grappled with throughout this process, is just wanting to achieve the goal of reducing kind of quickly. That was always kind of a desire. And I think that it can be hard for a lot of people to understand just how slow it sometimes needs to be. When you tell people sometimes that it could take a couple years, that feels hard, to understand that, I need to go through this process for that long. And so perhaps that like internal grappling when you are wanting to reduce a medication like this can be a challenge, but can you maybe talk about some other challenges, or the biggest challenges maybe that patients can face when attempting to taper off psychiatric medication?
I think it can be like the change sometimes. I think, for some of my patients who are, I work with some patients with bipolar and schizophrenia. Some of them are really about trying the non-drug interventions, like whether it's something like eliminating gluten or doing a ketogenic diet. But it's just so much more complicated than the person. I mean, these interventions happen at the family level, and so getting buy-in from the spouse or the parents to, hey, this is really going to be a change in the way in the way where we're eating right now. We previously, we've been getting fast food, or we've been getting, and we're not going to be doing that anymore. A lot of people may be using food as a way of comforting themselves. It's like a coping mechanism that they've developed in a way, and taking away something like bread or pasta it's going to be really challenging for them. And so for some people, moving to the non-drug interventions is hard. And also, like you said, some people will want to get off really quickly because they're just like, once I get off, everything will be better. And that's not the case. Off is not necessarily better for a lot of people. And sometimes it can be worse. It just has to be, it really is. The best way to come off is to do it once, and to do it right, and to do it in a smooth way. And really, it doesn't matter how long it takes you to taper off, as long as you're functioning well. And so I also think kind of breaking away of the, once I get off the medication, my life is going to be different or better or changed in some way. That's not always the case, and rushing off can be bad.
Yeah, I appreciate you bringing up the importance of support and how big of a role that can play in terms of being successful and making some pretty big lifestyle changes that you kind of have to come if you're going to try to replace medication with something. But I also really like what you said about, being intentional about this and doing it right. And one time, it was so interesting. I heard from someone the other day that they were talking about how they have a lot of trauma around deprescribing or around trying to taper or reduce medications just kind of as a psychiatric patient. And I also share that experience, and I'm sure a lot of other people do too, where, things like I talked about before about trying to taper and not really doing it slow enough, not replacing it with something, and how difficult that can be. And it can kind of result in trauma around this. And so, yeah, understanding that it is a really, intentional thing that needs to be done and not taken lightly, and going as slow as you need to go, being in tune with your body, working with your care team. And yeah.
And you've got to feel safe to come off as well, because I think a lot of people may not even try to taper, or they don't want to, because they're just like, how the hell am I going to, live without these medications? I mean, people start them for good reasons. I mean, I don't think, they're totally, suicidal thoughts, paralyzing anxiety. And so there's this part of them that's like, I could never live without the medication. And we deal with that a lot in the taper clinic, where, we'll get started and then people will say, I don't know if I'm going to live without it. And the only thing that I can say is, things change. If you are doing other interventions, I mean, you've matured, your life has changed, it's more stable. If you're doing other interventions, it's worth a shot. And you never know, and you will just never know whether you can or cannot go without the medications unless you try. And the only way to really get the answers to that question is to almost just dip your toe into the pool and just slowly ease into it and kind of peel it back, and do it in a controlled way so you can acclimatize to having emotions again. We have some people who've been on medications for 3 decades. I mean, they don't even know who their unmedicated self is. They're so disconnected from it. And so it's like reintroducing that person to their full range of emotions again can kind of be overwhelming. And so that's also why I like slow tapering as well, because you give those emotions a chance to, the person get used to them again. And then they build up confidence because they're like, I can handle this. And actually I'm seeing some benefits here. Yeah, I am more reactive and I am a bit more anxious, but I just feel more connected to people, and they can just kind of work through that experience of coming off medication, sometimes after decades, which is, it's, I mean, I'm sure you could imagine that can be crazy for some people.
Yeah. There's a lot of layers of what can feel scary in terms of this, in terms of feeling afraid of relapse, in terms of feeling, afraid of even just stepping into a new experience of your life can also feel scary in some way. And so, I appreciate considering that in it. So in terms of getting into what a provider-patient relationship can look like in terms of deprescribing, what role should a psychiatrist or prescribing provider play in the tapering process?
I really like, so I'm trying to think. So I like my setup at the moment with, a support coach and a tapering coach, but I would say, I think at minimum you want a collaborative psychiatrist who is open to it. I think another really important piece of it is to actually get a coach. We call them taper coaches in my clinic, and there's like a lot of them out there who do this kind of work. I know Will Hall is like a great one, Angie Peacock, and if you go on my website, taperclinic.com, and you go to the Contact Us page, we have directories to doctors and coaches there. But I think it's important to be guided by someone who has been on the medications themselves and who has come off. The closer their experience to you, I mean, if you're someone who's had bipolar or severe depression, you find someone who's come through that. If you had a psychotic illness, Will Hall is great. That's someone who's come through that, or even Lauren and her group. It would be a great place, because there's something really nice about working with someone who has actually been through the problem. And it's too much to expect to find a psychiatrist that can prescribe you medications, but also is going to be able to put themselves in your position and understand the fears that you're having. So I like at minimum a 2-person team of like someone who has been through it themselves and a collaborative prescriber. And then you just like layer on the things that you need. Like if you think that a nutritional approach makes sense for you, find like a keto coach or someone that's used metabolic therapies for psychiatric conditions. If there's a lot of interpersonal things going on, seeing like a psychotherapist would be great. If like interpersonal problems is playing a big role for you, if there's some work issues that are going on for you, you might see a therapist, or gosh, you might even go outside of traditional mental health and see like a job coach, someone who could just like help you get realigned on what you're really interested in. So I think it kind of depends on your situation, but yeah, always just a collaborative doctor, and then kind of layer on the professionals that you may need unique to your specific circumstance.
Yeah, I like that approach of kind of using your care team as a resource and building one that is more, custom to what you need. And perhaps it would be helpful to kind of talk about what the current state of, engaging with a traditional psychiatrist or prescriber is around tapering. And yeah, I think a lot of people are a little bit disheartened with their experience with their provider, myself included. At various points, my psychiatrist was recommending going way too fast, and it caused intense withdrawal symptoms. And I even went to him to say, hey, I think I'm experiencing these withdrawal symptoms. And there was just a clear lack of education around that as a possibility. I then was faced with feedback from him of, there's no way you're going through withdrawal still 3 weeks later. Like, there's just no way that that's what it is. It's your illness coming back, and you probably need to go back up on your medications. And I think that that's a very common experience, unfortunately, for a lot of people who may be trying to navigate this with their care provider.
Yeah, yeah, I was just going to say that's a really common experience, Lauren, and it's kind of why we started the Taper Clinic. But to speak frankly, a lot of psychiatrists aren't that excited about helping people come off the medications because, again, many of them are working in an insurance-based system where they're highly incentivized to see multiple people per hour to just turn a profit. And so that's happening in the background. And that means that if you come in and you're just like, well, I'd like to taper, and, maybe I need a liquid medication from a compounding pharmacy. It's just like, there's no way I can do this in a short visit. And they're just going to go, what are you talking about? I don't think that's a good idea. Many of them may have never even learned about tapering, or they've never even heard about how these other interventions can help people come off their medications before. And so they may just be quite dismissive, like, I think that's a really bad idea. I think you should just stay on the medication. So it can be really, really hard to find someone who's going to be invested to help you in the insurance system. I hate to say that. There are some directories out there for providers who are more passionate about helping people come off medications. So like the Mad in America provider directory is a great place. If you just search surviving antidepressants in Google and search like find a doctor, they have like a running blog page, and you just go to like the most recent one, and you could just say, hey, anyone know someone in Ohio? And it's all of these people coming off antidepressants. That's a great place. The Benzo Information Coalition provider directory is a really good place to find doctors. And so you may need to sniff someone out, but it's for a lot of doctors, they're just, when it comes to tapering, they've had experiences trying to get people off the medications before. They've like decompensated. They've ended up in the hospital. The doctor feels completely unresourced to deal with a complicated issue like getting someone off the medications and then kind of dealing with everything that comes up then. And so they don't do it. And yeah, it can be really hard to find someone invested in helping you come off these drugs.
Yeah, and this is not to like bash psychiatrists or doctors, because I think you pointed out very aptly that the system is kind of set up in a way that really disincentivizes being able to take that approach with patients. If a patient does not have access to one of these other providers who is more passionate about taking these alternative approaches or entertaining deprescribing, do you have any advice for patients in terms of how to advocate for themselves if their provider is hesitant to support deprescribing?
So the best thing to do would actually be to go to a coach, because getting off these medications is really complicated, and you need to, I hate to say it, you almost have to educate your doctor, and that can be really overwhelming. And so I would team up with a really good tapering coach. And so I think the best place to go is, probably the Benzo Information Coalition page, and you just want to look for tapering coaches. So Angie Peacock's a good one, Jennifer Lee in California, Chris Page is great, Laura Delano is good, Will Hall. So there's, and you could even search this on the Surviving Antidepressants page, looking for a good taper coach. That way you can at least do an assessment with someone and say, these are the drugs I'm on, these are the ones I want to come off. How can I work with my doctor to do this? And they could look at them and say, well, based on the things that you're saying, this is probably the drug you want to start with. I imagine, you'd want to do, a cut and hold or something like that, where you stay with tablets and you just split them. And they'd say, I think you should just tell your doctor that you need these medications and these tablets, and we'll do that down to this level, and then come back and we'll talk about, what a liquid is like, to get you the rest of the way off. That way you don't kind of come into your doctor and say, what do I do? I need you to figure this out, and you completely overwhelm them. You sort of come in with a different attitude. Well, not attitude. You come in more educated, and you could say, hey, I really want to come off, and I'm going to do it very cautiously, and I just want to use these tablets. Would you mind prescribing them for me? And I think if you can make it really fast and easy for the doc, they just be like, okay. And you just tell them, I'm going to follow up closely with you. I'm taking this really seriously. And then when you get to that next stage where maybe you need a liquid compound, you could say, hey, I think I'm at the limit of what I can do with this. I'm going well. Could you prescribe this in a liquid? And then you just rely on your tapering coach to tell you how to measure the liquids. So kind of finding like an expert to educate you and guide you, and then like distilling it down to like the one thing that you have to ask either your family doctor or your psychiatrist. That would be the best way to work with someone, I think, if it's that they're very time limited.
Yeah, I think that's helpful. I think that's really in line with the approach that I kind of took with my psychiatrist. And I think that can feel really hard for a lot of people, because just kind of inherent in healthcare in general, but especially mental health care, is this really ingrained power dynamic that often plays out with the provider up here and the patient down here. And it's hard to kind of balance that out to come as more of an expert that is kind of directing your own care in that regard. But I do think it's important. And I think you're right that having some sort of expert who can help kind of guide you along that process can be really, really helpful.
Yeah. Because the last thing your provider wants to hear is, I read this thing on surviving antidepressants and I'm terrified and I don't know what to do. And like, is like, they're gonna have no idea what you're talking about. So you kind of need someone to kind of be the container for all of your questions and anxieties, and then make it simple for the doctor. I really hate it because it shouldn't be like that. The doctor should be able to do these things, but I'm just trying to give you very practical advice for how people have been able to get off in those situations.
Yeah, I think that's helpful because, of course, you're right. There is this idyllic version of how healthcare is provided, but it's just not the reality of what a lot of people are facing. So, yeah, advice like that I think is going to be helpful for a lot of people who are trying to navigate this situation. Mm-hmm. We talked a bit in our interview on your channel about, kind of reactions from the community to you kind of taking this role. I guess I'm wondering if you can talk more about how your work with tapering has changed your perspective on mental health care, though you've kind of teased that out a lot, but I guess maybe getting more into what has kind of the general reaction been from your peers in psychiatry or from the broader mental health community of you being kind of a public face of these critiques of mainstream psychiatry? We're asking for a different way of looking at it.
So yeah, I mean, I'm not a popular person in my profession at all. I mean, when I post things on Twitter is usually where people come to bash me. It's I get a lot of support from people who have been chewed up and spat out by the psychiatric system, and they're like, yes, I see this, I know what's going on. And then a lot of academics and more of the mainstream people will essentially just say, I'm dangerous. I'm dissuading a vulnerable group away from taking life-saving medications, and how dare I, and people are going to be harmed because of it. And I think they just, they attack me. They're just like, you're just here because you're trying to make a name for yourself, and so there's a lot of like kind of personal attacks, and really, like, I don't know. I mean, the way I think about it is, it's sometimes I reflect on it. I'm just like, have I gone too far with this? But where I land a lot of the time is that I think I need to speak truthfully, and I also need to accept that, maybe, I may not be the voice that kind of connects for everyone. There may be some people who resonate with the way I say things, and that's okay. But really what I'm saying is, I don't think what I'm saying is that controversial. Ultimately it's like we are in a system that overprescribes medications, and we should be using non-drug interventions first before massively leaning on these meds. I mean, that's essentially my message. And yeah, gosh, Lauren, I don't know what to say. I mean, some people really don't like that.
Yeah, I understand. Like, on a personal level, I think that's a lot of what I've been experiencing too over the last year of sharing this. And yeah, I think that response is not doing justice to, difficult conversations that need to take place around these things. And really what you just said your goal is, I think, is something that everyone can kind of understand and agree with. And I don't think that it needs to devolve into this polarized conversation of anti-med or pro-med. It's a much more complicated conversation than just that. And there needs to be room to talk honestly about the experience and to figure out how to help people navigate it in effective ways that are going to be the most meaningful or helpful for them. And I think that that's really where your position is coming from, I think.
Now that I think about it more, I also think that some people are threatened. I mean, especially and I get bashed on by like heads of departments sometimes, and I don't blame them, because I think, one of the big messages that I'm saying is that, we are really doing a bad job at treating people in this current model, and our patients deserve more, and they deserve more options, and we've kind of turned prescribing into almost like a production line pill mill. And I mean, if you're someone and you're a head of a department and that's just being really critical of these people. And if you're a psychiatrist and there's some kind of acceptance that I think happens with psychiatrists where they just say, well, this is just the best it's ever going to be. We have limited resources and the meds are what we have, and I've accepted that. And then when someone says, no, we should be doing better, we should be not accepting the current insurance model. We should be also helping people in more holistic ways. They just think that it's completely unrealistic and unsustainable. And they just think, I live in like a fairy tale land. But they're the ones who have just accepted that this is just the way it's got to be. And I don't accept that for a minute. I'm just like, that's not good enough. And so I also think it could be really threatening for some people who are practicing in this way, and they're just like, this is just the way it is, to have some young doc just say, it's just really wrong and we need to do better. They're just like, who are you to say this? Because they need to go home at night and just say, I'm doing a great job. This is wonderful. They don't want to hear someone saying, hey, you just started people on a bunch of meds for no reason, and you're not really helping them. You're just kind of jiggling around the doses, and your patients deserve more. That's not a nice way to feel. And so I think a lot of my critiques, and I'm probably the most biting and harsh over on X, if you want to see things like that. And so that's probably, I think, where they're coming from and why it really gets under people's skin, what I'm doing.
Yeah, I think we talked in our interview before about, identity of patients or of, people living with mental illness being challenged or threatened by this all. But it was really interesting. I was listening to a clinician, a psychiatrist, who's engaging in research around metabolic therapies, talking about how it can feel really challenging for the clinician identity too. Because kind of what this is insinuating or implying is that they've been doing harm almost for the majority of their career. And I believe that no psychiatrist or doctor gets into this profession to do harm, that's the exact opposite of why someone would become a doctor or a psychiatrist. And so I imagine that could be a really difficult thing to kind of grapple with internally as well. And I guess that's where I'm coming from in terms of hoping that we can just be okay with, we did the best we could with the information we had, but as this new information is coming about how these things can be harmful, or conversations are developing about a more nuanced understanding of these interventions, there can be an openness to that and a receptivity to growing and evolving in terms of how we approach mental health care.
Yeah, I like what you said, because we're also talking about even how a lot of doctors have been trained to view mental illness, schizoaffective disorder, say no more, brain illness, genetic. And now there's people like yourself and a lot of the patients that I'm helping come off medications who have been on these drugs for like decades or more, who are like, no, I was intolerant to gluten, or, I was having metabolic problems. And now that I'm off, now that I've made these changes, I'm able to come off. I mean, it strikes at the heart of how you even view these conditions, as, not being these genetic problems in the brain, but actually there's a whole range of approaches that you could use to help people.
Yes, I mean, that is kind of its own message of hope. But is there any other message of hope or empowerment maybe that you'd like to share with our audience in terms of how they can consider their own journeys with psychiatric medications or with psychiatric care in general?
Yeah. I mean, it's crazy. I mean, I never would have believed, and I'm going to say, I mean, I have patients and they're like, oh, I tried the keto diet, it didn't do anything. And so these metabolic interventions, they don't work for everyone, but when they do work, it's outstanding. I mean, I've had countless patients now who have had, on antipsychotics, on ECT, written off, come off their medications with metabolic therapies. I never would have believed it when I was going through my training. One of our coaches, Trudy Slot, has been off. I mean, she got off her meds when she turned 40. She'd been on them for 2 decades, antipsychotics, ECT, all of that. She's been off for 5 years, completely stable, and she found gluten was causing the problem for her. She's planning to go to medical school now, and when she was sick, she was like this far away from being placed in a group home, and it's just. I mean, and so I see remarkable results for some of the patients with severe mental illness. I see people who are on antidepressants like come to life sometimes before my eyes. I mean, it's like they start to laugh again. I mean, they feel more connected. They start cracking jokes, and it's just like, who is this person that's emerging? I mean, coming off medications is. It's fraught with challenges, but if you are someone that is looking for, is still hopeful and is thinking, maybe this, in my heart of hearts, I really feel like maybe I don't need these medications. I think there is hope, and I do think it's worth a shot, because maybe it doesn't get you the whole way off, but maybe it minimizes your medication burden, reduces the side effects. But maybe it allows you to be off. And so, I mean, I've seen really, really remarkable things now that I just focus in this area.
Well, thank you so much, Dr. Josef, for joining us today. It's been wonderful getting to talk with you. And I also just want to say thank you for demanding more in terms of what we think psychiatric care can be and working toward improving that. I really appreciate your position on it. And yeah, thank you for the work that you're doing. I would really encourage everyone to go and check out Dr. Josef's YouTube channel. We will link to that in the description below. We'll also link to the Taper Clinic website if you want to learn more about that. But is there anywhere else that you would recommend people go to learn more about the work you're doing?
No, you nailed it. The YouTube channel is the biggest place. But I mean, we're on TikTok, Instagram, and Facebook, and all of that. So it's all Dr. Josef, Josef. So choose your platform of choice, but most of our educational and long form content is on YouTube. Yeah.
Awesome. Well, we will include links to those in the description below. And yeah, thank you so much again for joining us today.
Thank you for having me, and I really admire your message of hope as well on your channel. So it's an honor. Thank you.
Thank you. Take care.